Hi guys, Dr. Mandy here again, and today's video is going to be less about prolotherapy and more about why prolotherapy is needed. So there's four main reasons. I've mentioned in other videos that our bodies have a really incredible healing ability, but joints are an exception to that. And I know you're all dying to know why that is, so I'm going to explain that for you today. So the first two reasons are ice and anti-inflammatory drugs, and those are two very common recommendations we're given when we have an acute injury, but these two things are very detrimental to healing. Ice is detrimental to healing because it causes our blood vessels to constrict, so our little healing cells can't really get to where they need to go. Also, ice deteriorates our immune cells from working as best as they can. Our immune cells are very heat activated. That's why we get a fever when we're really sick. So when we put cold on an injury, we're kind of stopping our immune cells from functioning as best as they could. Non-steroidal anti-inflammatory drugs, that's what NSAIDs stands for. I know you were all wondering that. So these are things like aspirin and ibuprofen and naproxen, and they are anti-inflammatory. So they're stopping inflammation. But when you have an injury, we need that inflammation. That inflammation is all our immune cells going to the injury and repairing the tissue. So when we cut that off, we're not going to get a full, complete healing. And number 3, deficiencies. So even if you don't ice and you don't take any anti-inflammatory drugs after an injury, you can still have suboptimal healing due to deficiencies, and these can be hormonal or nutrient related. So the most important hormone with healing is growth hormone, and this hormone decreases as we age. So we have quite a lot when we're young and growing, and then as we age, we stop producing as much. So someone who's in their 20s is going to heal a lot quicker compared to someone in their 60s, for example. And there's other hormones that are involved, and kind of hormones all decrease as we age. So we can take that into consideration when we're doing prolotherapy treatment. Someone who's younger is going to need less injections compared to someone who's a little bit older. And nutrients. There's some key nutrients that are needed as the building blocks of collagen, of ligaments, tendons, and cartilage and meniscus. Some of these are vitamin C and the amino acids proline and glycine. So if we don't have as many of those nutrients roaming around in our bodies, we aren't going to heal as well from an injury. So even if you haven't iced your injury, you haven't taken any anti-inflammatory medications, your hormones are well balanced, and you have no nutritional deficiencies, you can still benefit from prolotherapy because of number 4. So normally our ligaments and tendons and collagen fibers in general run in a linear fashion, side by side. But when we injure them, the way they heal is very messy and kind of jumbled up. So what prolotherapy does is uses needles to inject solution in a very linear fashion so that those fibers can once again run side by side and restore proper joint function. When we have proper joint function, that's when we really decrease our pain and prevent things like osteoarthritis.